Hi everyone. For those who can see me on Instagram, welcome to ATP Live. And I guess those who are seeing me on Facebook, I hope you can see me. If you can see me, just let me know you can see me, and I hope you can hear me right. All right. Welcome to ATP Live Monday. And I'm just going to try and share all the videos to all the various platforms so that everybody can see me wherever they are watching from, and then we can kickstart. So if you have any else questions, please start dropping them now so that we can have enough time to answer them. All right. So just a minute while I share the videos. Today I'm going to be solo. Unfortunately, due to some reasons, my other moderator will not be able to join me. But I will try and do my best. So try and ask your questions as soon as possible. All right, so you're welcome. I'm just trying to share the videos. And I'm just making sure it is pinned on all our Facebook groups. Okay. Welcome everybody. Just give me a minute while I just make sure that all the videos are pinned and visible to everybody. Okay, I guess I'm done now. All right, so I can go back to my StreamYard page. Okay, and I can see the comments have started coming in. All right, I just hope you can see me nice and clear. Okay, so if you have any, so welcome once again. Let me welcome everybody. For those who are just joining, my name is Paediatrician. I'm a pediatrician, and what I'm going to be doing today is I'm going to be answering all your child health questions. So if you have any child health question, please drop them as comments. If you're watching me on Instagram or on the Ask the Pediatrician Foundation page or our YouTube or our Ask the Pediatricians Facebook group, you can just drop your questions on the page where you are. I will see your questions in the comments. I will read them and I will answer them. But if you are watching from a shared video, either on ATP Family Physician Facebook group or ATP Still a Mom group, you will have to click on the video and so that you can go to the page proper to drop your question. If not, if you just drop your question in that group, I may not be able to see it and I won't be able to answer it. So it won't be like I didn't see your question or I ignore them. So please try and do that. And I've been warned that this program is supposed to be 1 hour. Sometimes I try to make sure I accommodate all the questions that come in, and sometimes we run over time. But what I've decided that any question that come in before 7, I will answer. Once it is 7, please don't drop any questions anymore. But you can always post your questions on our ATP Facebook group from Monday to Saturdays, 24 hours every day. And one of us, the professional moderator, will be able to attend to your questions. So don't feel bad if you are late and I couldn't answer your question. Just make sure you watch the video all over again, because most likely I may have answered a question similar to yours, or you can post it on our Facebook group. So you have options for us to post. So this is just for an hour, just to do a marathon of answering questions. Okay, so I guess I better start running now. So I'll start with those on Facebook, because surely it's a bigger platform, so more questions, and then I will want to come back to Instagram and answer your questions. So thank you so much. Yes, thank you. Precious for telling me you can see me. Thank you. Good evening, Professor. Good evening, Facebook user. For those of you on the group, if you don't give StreamYard the permission to see your name, I won't see your name. I only see you as a Facebook user. Thank you, Princess. And Professor, thank you for that prayers. Ilisomi, thank you, Mudupe. Thank you. Okay, so all the preliminaries are done. Facebook user say thank you. Good evening, Dr. Fleming. Please keep up the good work you're doing, ma. God bless your good health. Oh, thank you so much. I appreciate your kind words. Okay, so I have so much good evening, and yeah, thank you. So yes, okay, Professor asked a question. Please, I need solution to ELA and rashes all over my baby's body, 5 months old. Okay, so thank you so much for that question. So ELA, for those who are non-Yoruba speaking, is a Yoruba word for rashes. In fact, they use it for virtually all the rashes. Or some type of rashes, let me put it that way. The thing with rashes is that you really need to see a rash to know the type of rash it is, and not only to know the type, but to be able to also know the cause, and it is the cause that will determine the treatment. So if you're asking a question on this kind of a platform because you're only telling me I've not seen the baby, I've not seen the rashes, it's difficult for me to tell you what to do. So what I can suggest for you, for Professor, is that you will need to post your question on our Facebook group and put a picture of the rash, not the private parts area, please. It has to be parts that are not covered by underwear, basically, and then we can look at it and we can tell you whether it's what we think, and then we can tell you what to do. And if you even need to see a doctor in terms of prescription, then we can tell you to do that. So, but it's difficult to answer a question about rashes without seeing rashes. There are rashes that you don't need to do anything. There are rashes that are due to allergies, and all you need to do is to stop exposure to what the child is allergic to, and the rashes that are due to infections, maybe bacteria, fungal. So sometimes they look alike, but it takes a professional to tell you this is the one, this is that one. So it's better you post a question with a picture, and then we can answer you. I hope that is helpful. Thank you. Please start posting your questions so that I can answer them on time. And another Facebook user is saying my child has ringworm, okay, on the head. I took to Badger and they gave us Refusil. What else can you do? No, there's nothing else you can do. So I like the fact that you know that your child has ringworm. You've taken to the hospital. You've seen a pediatrician, and you have been given treatment. So that is fine. So just give what you have been asked to do. Ringworms on the head, it takes a while for them to heal properly. And so usually the medication they give you, they will tell you how long you're supposed to use it for. So whether it's I will imagine that for that one it's going to be 6 weeks. So you better make sure you use it for that duration. And I know sometimes parents, when you are treating those rashes and you've used the medication for a few days and it seems to be working and it seems to be clearing, people begin to like, okay, that's all, then they stop. Please don't stop. You need to use the medication for long. You have to complete the treatment for as long as your doctor has recommended, and that is the only way it will be effective. So you don't need to do anything else for now. Just do what your doctor has asked you to do. All right. Thank you so much. Somebody said not hearing you, ma. Okay, I guess every other person is hearing me. Maybe it has to do with your network or your volume. Just check and make sure that I think I'm maxing my volumes there, so you should be able to hear me. So just check your own connections and stuff. Umukoro, good evening. Lots of good evenings today. Miracle, I can hear you. Thank you for letting me know that. Okpe, keep up the good work, Dr. Bemi. Thank you. Hello, ma. Good evening. Okay, yes, I've got a question now. Facebook user is saying my 2-year-old run temperature 2 days ago, it was 36.8. Okay, let's stop there by saying 36.8 is not fever. That is normal temperature. So I gave paracetamol and it came down to what? You didn't tell us what it came down to, but 36.8 is not even fever. So you don't need to have given paracetamol. Fever starts from 37.5. So it's 37.5 and above, that is fever. So anything less than 37.5 is not fever. I know that sometimes mothers feel that their children feel warm, and then that is why I'm happy you have a thermometer. You use a thermometer to check, and since your thermometer is saying it is 36.8, then it is not correct, because that's the reason why we have a thermometer and not rely on our hands, because our hands can be inaccurate. So that is why you should use the thermometer, which you have used. But where you went wrong is that you didn't interpret your reading. 36.8 is actually normal temperature. It is not fever. So there's really no point to give paracetamol. And now you say your baby woke up with rashes on her face. What could it you say what could it be, or what caused it? I don't know. It's like you left out a word. Okay, so I don't know the kind of rashes your baby has on the face. Paracetamol is very unlikely to cause rashes. I don't know. So it's better we see the rash itself for us to be able to say what it is. It may not even be related to the fever. I mean, it may not be related to anything, because your baby didn't even have a fever to start with anyway. So the rash may be on its own. You don't always have to be linked together, because from what you've told us already, your baby didn't even have a fever. So if you're worried about the rashes, it's better you show a picture of the rash on the group, and then we can look at that, and we can tell you. Okay, yeah, whether 2 years, 3 months, or 2 years, it's the same. It's fine. Okay, it came down to 35.5. Yeah, so 35.5. I have a feeling it's either your thermometer is reading wrong, because most thermometers cannot read 35. You need a special thermometer to read temperature that is lower than 35. But no worry. But from what you've told me, I'm not sure your baby really have fever. I just say just watch. If you're worried about the rashes on the face, then it's better you show us a picture, and then we can advise you further. All right, I hope that is helpful. Okay, let me come to my Instagram family and see so many. Okay, Instagram people are on fire today. Oh, so many questions already on Instagram. Okay, Instagram, just give me a few minutes. Okay. Thank you, Khadija Agbola, for telling me you can hear me. Thank you for everybody. Sorry if I can't mention your name, because time is going. Okay, Kemi Blessing is saying, how do you handle cough in a 3-month-old toddler? Okay, let's start by saying a 3-month-old is not a toddler. A 3-month-old is an infant. Okay, so I know parents use these words interchangeably, but I'm happy you told me the months and not just saying my toddler, because then I would have been confused completely. So any baby less than 1 month is a neonate. Any baby less than, or a newborn, newborn is everybody from 0 to 28 days. From 1 month to 1 year, we call them infants, and from 1 year to 3 years, we call them toddlers. Okay, all right. I will stop there. I won't go with the other ones. So cough. There are many reasons why a baby can cough. For a 3-month-old, most of them cough if they're really coughing like seriously, because cough is actually a normal thing. People always think cough is bad. Cough is actually a normal reflex. So what cough does is that whenever something is going down the airway that should not be going down the airway, you cough. All of us do. And that cough reflex is to stop the wrong thing from going down the airway. So that is the purpose of a cough. So cough is a normal reflex. It is okay for you to cough. But however, if you keep coughing continuously, so in other words, you try to cough and keep coughing, then everybody start noticing that you're coughing, then that means something else is wrong, because this is not supposed to be something you're supposed to be doing continuously. And that may tell us a sign of something going wrong. So it could be like an infection or anything, depending on other symptoms. So but the commonest one most people cough for is due to infection. But for a 3-month-old, the commonest cause of what we call respiratory tract infection in them, which is the most common thing that will manifest as cough, is usually viruses. They are viruses. Those are the kind of infection that cause those cough. And they usually pick it up from other people who are coughing, maybe you yourself or other siblings who have been going to school, coming back home coughing, or people carrying baby, kissing baby, coughing, and depositing their germs on the baby. And the good thing about viruses is that they resolve on their own. They don't require any particular drugs or treatment. So most of them will run their course, usually over like 10 to 14 days, and then they will stop. So what we normally do is more about prevention. It's more about making sure the baby is protected from further infection. So we will say make sure you keep breastfeeding exclusively. It's one of the reasons you breastfeed your baby exclusively, and keep your baby warm, and just let it run its course. Don't give any antibiotics. The only time you will need to consider taking your baby to hospital is that if your baby is coughing and is having high fever. So high fever like above 38, 39. Your baby is having difficulty with breathing. Baby cannot breathe down well. The baby is breathing with so much difficulties. Or fast. Baby is breathing so fast. That means baby may have what we call pneumonia. It's a form of chest infection as well, but this time around, most likely bacteria. And those are the ones that you need to now take the baby to the hospital. So from your question now, you just said, okay, you said, oh, sorry, I made a mistake. You said 19 months old. Yeah, your 19 months old is a toddler. So for that age group, it's still most likely viral infection. So and so it just, if the child is not having fever, the child is not breathing fast, the child is not having difficulty with breathing, then just observe, give lots of water. That baby 19 months old can take water, can take lots of fluids, and they'll be fine. It will resolve on its own. And keep them away from people who are coughing and all that. Like if they can stay at home and not go to the play group or crash or wherever the baby goes. So that's also the episode that's resolved. Okay, but if dad is having fever and fast breathing, then you need to take to the hospital. I hope that is helpful. So Khadija is saying, how often should a baby of 12 months eat? My baby wants to eat all the time. Okay, thank you so much. That's a very good question. So a baby of 12 months old, is a 1-year-old, yeah? Okay, she'll eat about 3 times a day, and that is complementary feeding, but the baby can breastfeed as often as the baby wants, because we want you to keep breastfeeding up to 2 years. So your baby should still be breastfeeding, but should eat 3 times and have at least 2 snacks. So between the breakfast and lunch, there should be 1 snack, and between the lunch and dinner, 1 snack. And the snack is meant to be healthy snacks. So things like fruits and all that can be used as snacks. So that's what we expect from the baby. And there's also quantity that the baby should eat. So, and it's good to let the baby have a good routine. So the baby should not some babies tend to graze. In other words, they just eat a little bit of this, and they will go and play, then they'll come back, I want to eat a little bit of that, go and play. That is grazing, so which is not what is expected. So you should have like a regular meal time, and then but in between those meals, and maybe can have snacks, and that should be okay. If you want to know more about how to feed your 1-year-old, you can watch. We have lots of videos on feeding. It's available on our Facebook group, and then you can watch that, and you will have all this information there. All right, I am Rama said, my 21-month-old baby is yet to talk. Should I be worried? When you say yet to talk, like no word, no mama, not baba. If a 21-month-old does not have any word at all, because some people say yet to talk in the sense that you are thinking of sentences, no, that will not be worried. But if baby doesn't have any single word, like mama, baba, all those kind of words, then you need to see a speech therapist. A 21-month-old should be at least combining 2 words together. So if the baby doesn't have any single word, yes, I'm worried, and then that baby need to see a speech therapist, and the speech therapist may decide to refer you to see a developmental pediatrician. Okay, Esha Beauty saying, what can I give my daughter of 11 months to hard weight? She's not having weight, so I've taken her to the hospital. Doctor said she's fine. Now, Esha Beauty, you have not provided any information, because you say your baby is not adding weight, but you have not even told me the weight. So how do I know whether I should worry or not? So if you want to ask a question about weight, then you have to tell me what the weight is. Then I'll be able to tell you yes. And obviously you've seen one of my colleagues who already told you the baby is fine. So maybe the baby is actually fine then, because if you want my own opinion, then I need the weight to be able to know. But anyway, what baby needs to eat to gain weight is food anyway. But at least let us even know whether we should worry about the weight or not. Okay, show me for King is saying, what is the normal temperature? Normal temperature is 36.5 to 37.4. 36.5 to 37.4. That is what that everything within that range is normal. Anything less than that, anything higher than that, we worry about fever. Yeah. But it can be mild fever, so that 37.5, 38, those one are still mild. But by the time you're getting to 39, you're talking about high fever, 40, those are high fever, and we worry about that. Naomi, hi, Naomi is one of our volunteers. I say, good evening, ma. My child food blood count was high. What does that mean? And was given period and camosunate. Period. What is period? I don't know what that is. But the child is complaining of feeling dizzy and weak. She's 8 years old. Okay, so Naomi, it's better if you tell me what is wrong with your child. You didn't tell me whether baby was having fever. Why did you have to do a full blood count to start with? That is more relevant. And then but you said the full blood count is high. Full blood count is a big term for the whole blood cells. So there are different parts of that full blood count. So you have the red blood cells, you have the white blood cells. Is it the white blood cell that is high? Is that what you want to say? Or is it the red blood cells? Or is it the platelets? So which part of it is high? So you can't just say full blood count is high, unless you mean white blood cell. So the information you provided is not very clear. But your baby was given camosunate. Camosunate, yes, can make a child dizzy. Yes, it's one of the side effects. So yes, and it can make them weak as well. Yeah, it's a camoquine effect. Camoquine can cause all that, and yeah, that's why actually for camosunate it's better you take it in the night. Yeah, so that you can go and sleep after and you feel better. But it's one of the side effects of the anti-malaria. It's not enough reason for you to stop the anti-malaria unless the child is really feeling so bad. And but what you've told me now, you didn't tell me your baby has malaria. You only told me your baby's full blood counts, and full blood count has something to do with malaria. And the question I'm asking myself is that why is the child being treated with anti-malaria? But you also didn't tell me what is wrong with the child in the first instance. So it's a bit difficult to answer your question. So maybe you want to re-ask that question. Start by telling me what is wrong with the child, the symptoms that make you went to the hospital, and then what did your doctor tell you they are treating you for. So what I always educate people about this all the time, when you go to the hospital, when you finish seeing the doctor, you should ask at least 3 or 4 questions before you leave, because they always ask you, do you have any questions? Most of you say, oh, no question. No, you should always ask 3 or 4 questions, like a summary. What exactly is the diagnosis here? What exactly is wrong with my child? What exactly are you treating? So that is number one question. Most people leave the hospital, they still don't know what the doctor is actually treating their child for. You should know. Sometimes we are not sure, we are not 100% sure what is wrong with your child, but we should tell you, this is the 2-3 things I'm thinking. I'm thinking your child may have malaria or infection of this or that. We should be able to tell you that information. And then we should tell you why. If we are not sure, then we tell you how we want to confirm. Okay, I want to do blood tests. Or sometimes we just tell you, okay, I want to try treating this one first, because I think that is the most likely one. So you should know, you should know what we are doing. You should not be in the dark at all. And then after that, you should ask, what are you treating my child for? Then what medication are you giving my child? You should know the names. And why are you giving that medication? Sometimes the reason why your doctor is giving you a medication may not necessarily be because of what is wrong with your child. So for example, your child may have diarrhea. I always like to use an example of diarrhea, and the doctor is giving you ORS. Now, the doctor is not giving you the ORS to stop the diarrhea. Most mothers think when the doctor gives me ORS and oral sync, it means the diarrhea is going to stop. No, the diarrhea is not going to stop with ORS and oral sync. The doctor is giving you the ORS to replace the water that your child is losing. Is giving you the oral sync to heal the intestine. It's not to stop the diarrhea. So you really need to understand that the fact that you went because your child is passing watery stool, and we give you a medication, does not mean that medication, which is what most mothers assume, is to stop the diarrhea. Then when they get home after 1 or 2 days and diarrhea has not stopped, then they say, oh, the doctor gave me drug, but it's not working. And why is it not working? Because the diarrhea has stopped, but the doctor has not promised to stop your diarrhea. But that is actually why ideally we should talk to you, educate you. But most doctors are always so busy, and they just give you out my door and you don't even understand. So because if you see me, I will have told you I'm giving you the ORS because I can't stop the diarrhea. The diarrhea is going to stop on its own. Is going to stop on its own. Max 10 days is to stop on its own. But what will kill a child from diarrhea is not the diarrhea, is the dehydration, is the loss of water, is the loss of the electrolytes. So I'm giving you the ORS so that we can be replacing what the child is losing while we are waiting for the diarrhea to stop on its own. So that is one. But if I give you anti-malaria, for example, I can tell you I'm giving you the anti-malaria to stop the malaria itself. And it's not going to work in one day. Some of you take treatments in the morning. I mean, you've been to your doctor in the morning, then you're asking Dr. Gbemi in the evening, like nothing has changed. Why? It's not going to stop in one day. You have to wait time. There's time process. Drugs take time to work. When you take drugs into your mouth, it's going to get absorbed. It's going to go to where the maybe the malaria or the infection is, and it's going to work down. That's why we give you drugs for 3, 4, 5 days, because we know that it's not going to do the work in one day. So you really need to be patient as well. So the doctor surely should have told you it's after 2, 3 days. If there's no improvement, then you come back. So you have to be patient. So you need to know what the doctor is treating. You need to know what medication the doctor is giving you and what those medications are meant to do. Then you need to ask what are the side effects of those medications, so that if you take a medication, like if you are giving you camosunate, somebody should have told you it can make your child dizzy. If you know already, you won't be worried, because you already know it's a possible side effect. And that's why we should also read the leaflet. So every medication always has a leaflet inside. It is not put there because we like it for decoration. It's actually put there so that we can read it. And so if you read it, they'll say these are the common side effects, these are the rare side effects. Most of the common side effects, we don't need to do anything about it. We just live with it unless it's really very bad. If it is bad, we may have to stop the medication and give you an alternative. And then, but the doctor should also tell you which side effects should make you stop the medication and come to the hospital. So, for example, some medications, if you take them and you start having rashes, we expect you to stop the medication and come to the hospital so that the doctor can give you something else. So these are the kind of questions you must always ask your doctor before you leave. I know that some of you will say, the doctor will always say, they don't have time, they want to shut you down. But please know your rights. You have your own rights. You also have your own responsibility. The doctor has a responsibility to tell you that, and they should tell you that you should demand for it. And if when you do that, the doctor know, and then the doctor too will make sure that they do the right thing. So I hope I've used this opportunity to quickly educate us about that. So that's a side. Let's just quickly go down. Sunny Tiny, my 2-month-old have mucus that make it seem like he has catarrh, and the room temperature is not cold. What could be the cause? When you say a baby has mucus from where? From the mouth, from the nose, from the eyes? I guess it's from the nose. But I still don't get the question. So just clean the mucus and let the baby be. I mean, if the baby is having mucus coming from the nose, I mean, like catarrh, then just clean it. That's all. It's also a form of a infection. Most of them are viruses. The commonest reason why babies have these things is those kind of infection. They are not caused by temperature. They are not caused by room temperature or anything. That's a wrong assumptions. They are caused by people coming with all their germs to greet your newborn baby and sneezing into the baby. And people, your other children who have been in school, coming to hug their baby brother, kissing them. That is where all those infections come from. Trust me, that is where they come from. So that's why we always say, wash your hands. I think at least Corona has taught us that now. Wash your hands when you want to sneeze into your elbow. Don't sneeze onto the baby. And this African culture where everybody carry baby, kissing baby, you are just passing germs to them. It's actually not a good culture to encourage. At least they must wash their hands first. And if they have cough and catarrh, they shouldn't come near a baby, or they should wear mask. So those are the common, and then of course breastfeed your baby so that your baby, because a newborn baby doesn't have much immunity. So when you breastfeed them, you are passing your own immune agents or antibodies you are passing into your baby so that your baby can, you know, can fight some of these viruses until they begin to develop their own. So those are the things you can do to prevent that. Okay, I think I need to leave Instagram and come back because Facebook is cracking now. Okay, you mean your baby has blocked nose. Okay, if the mucus is blocking the nose, it is not flowing out, you can put saline drops there. Yes, which that is fine. That's good. Yeah, so you're already doing that, and that's fine. What's maximum quantity of a baby of 16 words? You said 16 days, 16 months, 16 weeks, 16 years. You need to be very specific. I'm not so sure. And why do you want to know the water? You can take as much water as baby wants. Don't pass 3 liters most of the time. If your child is taking too much water, then we need to worry, and the child is passing a lot of urine, then you need to check whether the child has other condition. But most of us know our body tells us how much water you need, because when you don't drink enough water, you feel thirsty, then you go and drink water. So, but averagely 2 to 3 liters of water in a day will be fine for everybody. That's fine. So let me go back to Facebook. My Facebook has okay. Try and keep your questions short, straight to the point, so that we don't okay. So good evening, I guess, Dr. Bemi. After one negative, I gave birth. Okay, I am O negative. Oh, okay, please. Okay, don't worry. I can understand now. I am O negative. I gave birth. I was given a Rogam injection, I believe, although she's 1 year old. But for my baby, I don't know if she needs any treatment. Your baby doesn't need any treatment. If you are rhesus negative and your baby is rhesus positive, that is the only time you will be given the Rogam injection, and the baby doesn't need any treatments. Because your baby is usually sick or fever, and I see some pieces of cheese ball. Where are you seeing the cheese balls? Is it in the stool or what? I don't know a blood group. You should know a blood group. Was your baby's blood group not done? I'm sure the doctors must have done your baby's blood group, because for rhesus negative mothers, those of you who have negative in your blood, so usually your blood group is either A positive, A negative, B positive, B negative, O negative, O positive, AB positive, AB negative. For those of you who have the negative part, it is what we call rhesus negative. Now, if you are rhesus negative, it means if your husband is positive, most people are positive. Maybe 90% of people are positive. Only very few people are negative. So which means that the chances that you're a negative person married to a positive person is very high. So which means that you can have a positive blood group, rhesus positive blood group baby. Now, if you can also have a rhesus negative baby. If your baby is rhesus positive, that is only time you need the Rogam, because what that means is that your baby's blood may have synthesized your own blood to produce what we call antibodies to fight your baby. So, and so because of that, what we normally do is to give you Rogam to clear that your own antibody, so that when next you're pregnant and you have a rhesus positive baby, your blood don't attack your baby, and your baby can either die in the womb or have jaundice or things like that. So, but if your baby is also negative like yourself, there is no reaction, because both of you are the same blood group. So your body is not going to develop those antibodies. There's nothing to fight, because what makes you positive or negative is the fact that those who are positive have something, what we call an antigen, the D antigen on their own red blood cells. Why those of you who are negative, you don't have it? So when those of you who are negative see a red blood cell that has the D antigen, you see it as a foreigner, as a stranger, as a foreign body. So you want to attack it and destroy it. So that is what normally happens. So, and that is why they give you the Rogam, because if your next baby is positive and you already developed those antibodies, it means that you're going to attack, your body is going to attack that baby, and that is why we don't want to happen. But if your baby is negative, they will not need to give you Rogam, because you have not developed any antibodies. So it is not like once you are rhesus negative and you have a baby, you must always have program. It is not automatic like that. It's only if your baby is rhesus positive that they need to give you program. So you can go and do your baby's blood group though. So that's what you need to do. But your baby being sick has nothing to do with rhesus negative, rhesus positive, nothing whatsoever at all to do with it. So I think you are just making assumptions. Please try not to make assumptions. If your baby is sick, take baby to the hospital. Don't always. I found out that in Nigeria, we always try to figure out why. And we always try to, so people will tell us this is why you, and these people don't even have no medical degree, nothing. Even sometimes doctors that went to medical school for CCA, we tell you we are not sure. But people that don't even know nothing, they will always tell you it's because you're like, what did one woman tell me last week? Okay, your baby is having boys, and somebody just told her, oh, it is your, because of your body, it's your breast milk that's making you, I mean, such nonsense. And she believes it, and she's asking, because usually when people ask me such questions, it means that you believe it enough to even consider asking somebody else about it. Don't listen to people who have no authority whatsoever or no qualification to advise you on issues. So, for example, I'm not going to listen to my I'm not going to listen to my hairdresser about my car, because that is not her expertise. I mean, if a mechanic tells me something or a hairdresser tells me something about the car, it means I should listen to my mechanic, not my hairdresser, and vice versa. So it bothers me when people listen to people who are not doctors, who are not health professionals about the health issues of their children, and they take them serious. People who know nothing. That's why people were bathing salt during the Ebola saga. And many people died from that salt rather than from the Ebola itself, because we are listening to people who know nothing. And those guys were even just playing pranks. And they got many Nigerians, because we always believe what anybody just tell us. Before you believe something, you need to ask, what is the authority by which this person can even tell me this? So somebody who has no medical degree cannot just tell you it's your baby, it's your blood fighting your baby. That's why your baby is having boys. And you just believe it. I don't know why we find it easy to believe things like that. Please, let's not do that. And also, let's not make our own assumptions. I think one day I'm going to take another life again about myths. We just deal with all these myths on health issues. I've written a lot about them. If you go to our website on www.askthepaediatricians.com, I've written about the good, the bad, and the ugly when it comes to myths. There are some myths that I don't mind. I don't fight them because they are good, even though the explanation has no no basis. But there are some of them that worries me, because people now, they put people at risk. They can cause our children to face lots of danger. So this child is being sick. It has something to do with your blood group. Just take baby to the hospital. Let the doctor know why your baby is being sick and let them treat it. That is the number one. Then you say your baby has lice on her head. We cut it off. If you cutting off the hair is not enough treatment for lice. There are products, usually benzoate. If you go to the pharmacist and ask them, they have them. They will tell you things that you can use to wash the baby, to treat the hair so that the lice will die. So all children go to school, they are exposed to those things. It's not because you are not hygienic or anything. It's one of the things about children, especially when they go to school, play with other children. So if you suspect it, call the hair, but you still need to use the right treatments for it. You can get it. It's something you can buy by yourself. You don't need a prescription for it. Any of the pharmacy will give it to you, and you wash. And I think you have to retreat it after 2 weeks so that you make sure it's really completely got rid of all the nits as well. I hope that's helpful. All right, I posted in the group, but my post has not been approved, so I think I should ask here. Yes, you can ask here, but it may take up to 40 to 72 hours to answer your post, because as I'm here now, there's no way I can be answering on the group as well. So that is why if you read our group rules, all these things are already covered. Okay, so Shizam is asking, my neighbor twin girl's old piece on her body, even when she's sitting down. I told her I will ask her, because she's not using. Okay, you are asking on behalf of your friend. Okay, I get it. She believes that the twin brother oppresses the twin girl when they were in the womb. Okay, because the male one is smarter. Again, this is exactly what I'm just saying now. People, all sorts of myths. I mean, how does a 2-year-old pain on her body has to do with the brother oppressing her? nothing. It has nothing to do with it. So yeah, that means the child is not just toilet trained yet. If the child is not yet potty trained, that is it. It does not mean the child. It doesn't. It has nothing to do with the twin brother. The fact that and twins are different individuals. Even these are two. They are boy and a girl, so they are. The only thing they did was just share a womb. That's all. They didn't even share placenta. They didn't share nothing else. They just share the mother's womb. They are not sharing the same genes as well. This is just like a brother and a sister. Like, so twins that are not the same gender, that are not identical twins, they are just more or less like brother and sister coming at the same time. So they are two different individuals with different genes, completely different from each other. So this has nothing to do with the brother oppressing her. The girl needs potty training. That's all. If the girl has other issues because one is smarter, it's because some twin babies, when you have many babies in the womb, what we call multiple babies, they have complications. And usually the second twin, because sometimes they don't come out on time, they may suffer more complication than the first twin, and that can affect them. So depending also when they were they born premature, were they born very small, like low birth weight? There are many things that could have happened with a twin baby that could explain if why the baby is having any difficulties. It is not because the other twin is oppressing. I mean, please, let's not start using this kind of assumption. These are the kind of assumption I was talking about. Let's not make those assumptions. So what she needs to do, is to take her the twin. I'm not even worried about a 2-year-old who is wetting herself because she's just not yet potty trained. So what the mother needs to do is to potty train her. And some children, sometimes it takes them longer, because there are many questions I would like to ask about this baby, which I don't have time to ask, and it's also not your baby. So you may not have all the answers to it. So I need to know, was this baby born at 9 months or not? Were there other problems when she was born? What was the birth weight? Were there issues this baby could have suffered when the baby was in the womb that could be explaining some of her difficulty, if she's having difficulties? Because you've only told me about wetting herself, you didn't tell me any other thing else. So it's difficult to answer that question. But if the mother really wants, so she can see a pediatrician who can ask all those questions, and then they'll be able to support her. I hope that is helpful. All right. Let me run now. Babalola say my baby is 5 months and he hasn't head up firm. I guess you meant the neck is not yet controlled. I'm worried about that. Neck control is from 3 months, 3 to 4 months old. If by 4 months your baby cannot control the neck, there is a problem. The baby has what we call developmental delay. The baby's development is slow, and we need to see that baby. You need to see a pediatrician first, and then, or a pediatric neurologist or a developmental pediatrician. Just see a pediatrician, and then we will see how to help the baby. But there's something wrong. We need to know what is wrong, and we need to deal with it. The baby may also need like physiotherapy and things like that. So please see us quickly. All right. Precious is saying my first time mom. Well, welcome. Newborn baby 9 days. Current weight at 7 days, 2.9. Yeah. Okay. My question: vitamin K was administered at day 7. Should I be worried? No. There's no reason to worry. Vitamin K should be given at birth. But if they forgot to give it at birth and they gave it at day 7, all well and good. Her stomach makes noise. She passed stool and gas. Should I be worried? No, you don't need to be worried. That is normal. She sneezes from time of birth, and her hands are usually cold. Should I be worried? So if her hands are cold, it is you that needs to keep her warm. So you can wear mittens. You know what that means is like gloves. For babies, still small. Hey, you wear something like that for her. Make sure you wear clothes properly. Keep her warm. So don't overdress, but don't also underdress. So that's what you can do. So wrap the baby, wear layers. So we usually say wear layers of clothes. So there's a cotton wears on the inside, and you wear the normal clothes on top. Then you can still wear like the knit stuff, like sweaters and stuff like that to keep baby warm. Wear socks, so then you can see baby is warm. If you think baby is becoming sweaty, you can remove one layer. So that it's easier to shed layers than to wear something thick all through. So you can take off the third layer and leave this last 2 layers, so you can always juggle it. So I hope that helps you. Then the sneezing, make sure you are not putting eucalyptus oil in the baby's oil that you put on the head, because I think most Nigerian mothers, I don't know whether it's written in the constitution that we must always put eucalyptus oil. You must always buy it as part of your maternity stuff, and you must put this in the oil because it's going to keep kata and all those stuff away. We don't recommend it. It's not necessary. And I think from my own experience, is the number one reason all the newborn babies in Nigeria are always sneezing, because that's what that eucalyptus oil do, makes them to sneeze and sneeze and sneeze. So when mothers complain their baby is always sneezing, the first thing I ask them, are you using silverbird oil? Are you using eucalyptus oil? The answer is almost 100% yes. And I tell you, just go and stop it. And that's the end of the sneezing. Okay. Is there danger associated with massaging the cord? Don't massage. You don't need to massage the cord. You don't even need to massage the baby. You just need to clean the cord with a methylated spirit, or you can apply the chlorhexidine gel. Chlorhexidine gel can be used just once a day. If you are using methylated spirit, you have to do it every 4 hours. So that's what you need to do. So, but there's no need for any massage. Don't use Lanta, that dry it, or which other one? All those things. I know what you know what I mean. In Nigerians, you know what I mean. So please don't apply any heat, or don't put any bandage around the cord. Leave the cord open to the hair, clean it, and keep it dry. That's all you need to do. The cord is there to fall. No, the cord gel is not to be applied 6 times. Oh my goodness. The cord gel is to be applied once a day. So when you finish bathing your baby, dry it, and then apply the chlorhexidine gel once in the morning, and that's all for the day. You don't need to apply it every second. No, that is for the methylated spirit. So I'm happy you're asking this question. I know you will have more questions because you're a first-time mother. So for first-time mother, I actually have a course for you guys. Okay, so if you want, you can reach out to me, but it's not free, so you know. Okay, all right, let's move on. Facebook user is worried. Okay, birth weight is 2.9, current weight at 1 year is 10.5. That's not bad. Is the weight okay? The weight is very okay. Is Weetabix cereal okay for babies? It's okay, but as long as that's not the only food the baby is eating. Babies are not supposed to be eating only cereals and milk. They are supposed to be eating, a 1 year, 5-month-old baby should be eating everything the rest of the family is eating. She won't be worried there's spaces between the teeth of this age. No, I won't worry, but you can see the dentist if you are concerned about it, because I don't know how wide it is, so I won't want to, but I personally will not worry, but the dentist would be best to advise. All right, thank you. Uloma is saying, I saw white something under my baby's tongue, like a growth since birth. I've gone to the hospital. The doctor said it's not tongue tied. I should be observing. It may disappear, but it's not 7 months, and it's still there, but not growing bigger. Just there. I'm still trying to figure out what is this whitish something. So I can't really say what it is, and I can't answer. But I believe since you've seen your doctor and your doctor is not worried about it, then I'm not likely going to worry about it as well. But if you really want me to know what it is, you can take a picture and send to our Facebook group, and then I can have a look, and then I will tell you. Okay, is controlling it every side. What do you mean by it's controlling it every side? Babalola, Adekunle, your question is not clear. You are the one that asked about your baby's neck is not firm. Let me just tell you what we want the baby's neck to be like at 5 months. When you pull your baby, so put your baby flat on the bed. Okay, I don't have a dolly here. I would have demonstrated it to you. But put the baby flat on the bed, lying flat. Grab the 2 hands of the baby, and pull the baby's hand only. If you pull a 3-4 months old baby's hand, they will come up with both their head and the neck together. So if the baby is coming up and the head is falling back, it's not in a straight line, then that baby does not have neck control. It's a very simple test to do. Just pull the baby by the hand. If baby's head is falling, is lagging behind, then that baby does not have neck control, and it is not okay at 5 months. But if your baby's head come up with both the neck, the baby will come up with the head itself. You wouldn't need to be looking for the head. Where's the head? You don't need to support the neck or anything. Then that means that baby has neck control. So that is what you need to do. If your baby is, and usually it's very straightforward. Most mothers know when you have neck control, because if you can back your baby without needing to put anything around the neck, and the baby's head will be straight with the neck all at all times. So that is neck control. But if your baby, when you're pulling the baby back up, the head is back like that instead of straight, then there's no neck control. You should see a pediatrician, let them examine the baby and let them tell you why, and let them um tell you what to do. Okay, Precious, I don't know what was your previous question, but you say you notice a white something in your baby's vagina. Can it be cleaned? Yes, it can be cleaned. If there, what can you use? Just normal water. You don't need to clean it with any special stuff. So for those who always ask this kind of question, babies can also have like vaginal discharge. Usually it's whitish. It's usually the effect of the mother's hormone. It's the same effect when they have breast enlargements, and sometimes it can even come out with milk. Sometimes they can also have whitish discharge from the vulva area, and sometimes they can even have blood as if they're having menstrual period. It's all due to the hormone, the same hormone that works on the mother in preparation for breastfeeding and birthing of the baby, can also affect the baby's organs and give all those effects. You don't need to do anything about it, because as the baby is born and the placenta has been cut, those effects of the hormones will wane within weeks, and it will all disappear, and all those effects will stop. So you don't need to do anything special in terms of the vagina or the vulva area of your baby. You wash it the same way you wash their tummy, the same way you wash their chest, the same way you wash their hands. You wash the surfaces like that, dry it, and that's it. Don't apply any dusting powder. Don't do female circumcision. Don't try to press anything. Don't use Vaseline to press nothing. Just leave it alone. Because I know so many cultures believe that they have to circumcise babies. We've been fighting that. It's a criminal thing to do. You should never circumcise a female child. For those who don't circumcise now, they now say, okay, they have to press it with powder or Vaseline or whatever. Please don't. Just leave the vulva alone. If you see anything whitish on the surface, wash it the way you wash any other part of the body. Clean it. Don't dip your hand inside. Don't try to do any manipulation. Just leave it alone. I hope that's helpful. All right. Sharifat is saying my baby is having problem with those big teeth. He can't chew nor eat better food. A 1-year-old actually don't chew because they chew with their molars, and so you at this age you should cut their food into tiny pieces for them, or you should match it for them. So they are not supposed to be doing a lot of that, because they usually do that grinding and chewing all those things with the canines, which they don't have at this age. So it's not something to worry about. So they shouldn't be just watery food. You can make porridges, you can make soft food that they can bite on and they can still eat it, but they just have to be in tiny pieces. That's all. And if you worry about more, you can see your dentist. The dentist actually wants to see your baby when your baby is 1 year old for their first dental check. So this is a good time to go visit your dentist anyway. So I would just advise see your dentist. My baby of 2 years fell, and the frontal, is it the head? Frontal, I guess. The front of the head got swollen. What can I apply to make it come down? So if your baby has, okay, I'll come back to falling later, but let's talk about how to deal with when the fall has happened. Just put ice pack. Just get like ice block from your fridge, tie it in a small like handkerchief or face towel. Just put on it. That's all. Don't massage. Don't rub. Don't put rub or ventilator or anything. Just ice pack. Because what happens when a child fall and has that swollen is blood that is there. And so what happens is that the fall cause the blood vessels to tear up and open up, and the baby's bleeding. That is why you're seeing that. So when you massage, you are going to make it bleed more, which is one of the things people do all the time, which is actually wrong. When you massage it, it's going to get bigger because you are going to cause blood to flow the more. Or when you put hot water, it's going to make blood flow the more to that area, then it's going to get bigger. All you need to do is to put ice block. That will stop the bleeding. and that's all. Just put ice, but give the child some paracetamol because we are not sure if it's a very bad one. Because we're not sure whether the baby has suffered a fracture underneath and all that. You may want to go to the hospital and they can do X-ray depending on if it's really very big. But if it's just a small, ball showing, you can just also put ice pack and it will go down. Please don't massage, don't rub, don't put hot water. That's the first aid. So for those of you we need, there are a lot of first aid apps online. I think you should all download them and you can just Google fall, head swelling. What do I do? They will tell you what to do straight away. Cut. How do I do it? They will tell you what to do. So I think Red Cross, Nigerian Red Cross has a app on first aid. You can download it and so that you can always check those kind of small stuff what to do, because people always do the wrong thing and make things worse. So it's good to always know. And there are first aid courses as well, and most of them are free. You can become a first aider, certified first aider as a parent. It's a good thing to do as well. I hope that's helpful. Just give him paracetamol, don't give him any other drug. But more importantly, the 2-year-old should not be falling. Please, they should be supervised. We need to be very conscious of that. We need to supervise them. We need to make sure the environment is safe for them. I think we wrote a lot about how to, if you just go online, but you also check our Facebook group, I've written a lot about that, on how to make sure the environment is safe for the babies. Some of them are climbing stuff and you just look at them and then you're surprised they fall. They are going to fall. They don't know because they are very curious, they are very adventurous. So that's natural for them. But that is why we are there as parents to supervise them and to make sure that those falls don't happen. Reason why I'm stressing is that some of you like, Dr. Baby like to stress us, is because a fall can make a difference between a child who will live a normal life and a child will be permanently disabled for life. I'm telling you the truth. I've seen perfectly healthy, normal, growing, happy little toddler had a head injury, and that baby gets to be in a wheelchair for life. And it is one of the most psychologically traumatizing situation for parents, knowing that your child was actually developing perfectly well. Now, I guess it's more difficult for those who already have babies with disability right from the time they were born. It's more challenging when your baby will actually be normal, developing well, now has a fall. So fall can cause that because we are talking about the brain here. The brain of a baby is still developing. Parents need to understand that unlike the rest of the body that are fully formed, the brain is not fully formed at birth. For the first 5 years of life, most of the brain development is happening. 95% of brain development happens in the first 5 years of life. Any injury to the brain in the first 5 years of life is serious because that may be the end of it. The child may not die, but the child may be permanently disabled. So please don't joke with baby's brain. Head injury is one of the commonest reasons why some children have a perfectly well developing child can develop disability from that. So please, let's not, because some people will post and say my baby is falling every day, and I'm like, and you're not doing anything about it. You think it's just a joke. It's not. I know they are very, they always put themselves at that risk, but we also need to be monitoring them and make sure it doesn't happen because it can be very serious. So please, it's very important that we don't allow it to happen. Okay, Honorable Babalola, I've answered your question. I've told you what to do. Do it and see a pediatrician. How many times do I feed my baby in a day who is just 6 months old? So Facebook user, you're on a Facebook group, you need to go to the guide section. Go to the guide section, do the course on complementary feeding. We have videos on how many times you feed, what quantity you give, what to give. It's better you do the complete complementary feeding course. It's our guide section number 2. It's very important. When you do it that way, you have all the information. You don't just need the information about what how many times to feed. You also need to know what to do, what exactly can you give, what quantity are you supposed to give, how do you go about it. Because I'm happy your baby is just going to be 6 months old, or your baby is already 6 months old, so you are just starting. So please go and do that training so that you have all the information about complementary feeding and it will be up for, oh my goodness, it's 7. Okay, so please don't drop any more questions so that I can just answer the ones that have come in. Okay, Precious saying, how do you pierce the newborn babies to prevent infection? So do it in the hospital, because you should use sterilized instrument and all that. That's the way to do it. So should I be worried about the cord navel pressing against my body when lying the baby on my shoulder after eating? It's okay. It's not like your baby is gum to your body 24/7 like that. That's just usually for like 15 minutes. That's okay. You don't need to worry about that. Good evening. My baby will be 10 months by tomorrow. Birth weight is 1.8 premi. 9 months was 8 kg. Some people came to our church yesterday for immunization, polio vaccine. They came to me. I told them my baby already has his 9 months vaccine. I don't think it's necessary. Am I medically correct? Polio vaccines went for each age group. Okay, so thank you for your question. When it comes to vaccination, we have what we call routine immunization. We also have what we call supplementary immunization. So routine immunization is the one you go to your health centers to take for your baby and they document it. But once in a while, the government, we want to prevent outbreak of some particular diseases, and then we'll do what we call supplementary immunization. So supplementary immunization is the extra. It doesn't cause your baby any harm to take those supplementary immunizations. So for usually supplementary immunization for polio, we give it to children between 0 to 5 years, and it doesn't matter whether they've taken the vaccine before. This is an extra, it's a supplement, because maybe there's a concern that maybe they've discovered another case of polio around that your area, and they just want to make sure that all the children are well protected. So we give supplements, additional, extra. It doesn't cause you any harm to take it. So it's okay for you to take it. Even though you didn't take it, it's fine, since your baby already has the vaccine as well, but it's okay for you to take it for future references. Okay, my baby has colic 3 weeks, and we try to come in, but before it does, it starts to run temperature. No, colic doesn't cause fever. If your 3 weeks old has fever, baby doesn't have colic. Baby is sick. And for babies less than 2 months old, fever is a serious symptom, because they can have what we call late onset sepsis, infection. So you should take them to the hospital. There's nothing normal about fever, unless you are covering the baby up. Maybe you are wrapping the baby to, because some of you will not open your windows, you will not use fan, you will not use AC, then you will wear sweater, cap, socks, mittens, then the baby is going to have fever from you causing the fever from too much wrapping. But if your baby is not in that category and your baby is having fever less than 2 months old, you should be going to see a pediatrician straight away. So I hope that's helpful. Also, it has stuffy nose. It is not flowing or even blocking. So sometimes people think baby have stuffy nose because they make some sounds. If you don't see catarrh or mucus, baby doesn't have any stuffy nose. Baby doesn't have any catarrh. It's just some sounds that you hear from babies have what we call a flexible airway. So you don't need to do anything about it. You should just leave baby alone. If your baby's breathing is fast, it's looking heavy, baby is having fever, then please take this baby to see a pediatrician, because there's a lot many things you're saying going on in your baby and all that. So you ask Precious asking about vaginal massage. I've already answered that question. No massage. No, what's the effect of applying palm oil on the baby? That one is just African meat. Please don't do it. I don't recommend it, because some babies are slipped, fell, and died from those processes. Yes, because when you babies are already very slippery, then you went to go and apply palm oil on them, and and they are very active as well, very wriggly. They can fall from your hand. So there's really no basis for that palm oil. There's no basis for any of those things. So, and there's no need for head massage. There's no need for oil on the top region. You can put 1 drop of oil on your baby's head just to keep the scalp moisturized, but you don't need to put oil every 50 minutes, like as some people believe that the fontanelle, they need to be putting oil. Please don't do that. So you need to stop it. Yeah, so Precious, I've told you all this information, all these questions you're asking me, I've answered them. I've put them together in a course. If you want that, then you should go for that, and I think it will be helpful for you. So I address all the myths. There are every section has its own myths addressed as well. Okay. Jokotade is saying, Is ginger and cloves safe to be added to the millet of a 6-month-old baby before grinding and saving? I would say no, because sometimes you never know whether baby is going to like it or not. Just make your normal cereal. If you want to make your millets, your maize, whatever, it's fine. Avoid too much of things that are spicy and stuff like that, because babies may not like them, and that may even make them not want to eat the food. Okay, so Rosemary, your babies are 1 year old. They are born at 33 weeks. 3 are working. Why the fourth is not yet to work? Should I give the fourth one calcium? No, because the fact that somebody is not working does not mean the person has calcium deficiency. The number one reason why a baby is not working is because babies is not yet developed to work. It has to do with the brain, it has something to do with the bone, it has something to do with the muscle. So there's no basis for giving calcium. So just leave the baby alone. When the baby is ready, the baby will work. I will not worry about your baby not working until the baby is 18 months. So the fact that the 3 are working and the other one is not working does not mean there's anything wrong with the other one. So just leave the baby alone. Like I said, if your baby is not working by 18 months, then you can see us. And then for your baby, we need to correct, because even though your babies are 12 months, they're actually not 12 months, so they're actually corrected age of maybe 11 and a half months old, because, or like even say 11 months old, because they were born they were born 7 weeks earlier. So you need to always subtract that until they are 2 years old. So there's nothing wrong with your baby. All right. Facebook user, my baby is at 3 weeks old, birth weight is sleepless, even after feeding, it cries, become fussy, and is very active. He stretches his arm and leg till he pass or pulls. Seems like a baby who is having colic. That's fine. There's nothing to worry about. It's a passing phase and it will stop. So don't worry. Okay, my baby of 6 weeks has blocked nose, had antibiotics, he having blocked nose. The doctor asked me to put saline drop when there's congestion. Yeah, just follow your doctor's advice. That's it. It's okay. She squeezed her baby to, okay, so this is, please don't give flagyl to your 3 weeks old. When you're asking question, you have to ask it in one pose. If you break it and ask, because I'm not seeing your name, I won't know it is you, I will think it's somebody else. But if it is your 6 weeks old that's this is a 3 weeks old that has what look like colic, please don't give flagyl. Please don't be giving antibiotics recommended for babies, by those who are not pediatricians as well, or doctors. Please don't. I notice a lot of people just recommend antibiotics for every little thing. Please don't give flagyl to that your 3 weeks old baby at all. Never. Don't do it. Just leave the baby alone. What you've described to me is perfectly normal in that age group. Babies, when they are passing gas or stool, they can wriggle, they can feel a little bit as if they're uncomfortable, and when they pass the gas, they're fine. Some of them have colic, and you may read more about colic, and it will go. And the fact that she sometimes cry when they pass the stool or gas does not mean there's anything wrong with her head. It's just some of them just feel that movements of gas or spool passing through the intestine. They feel it and they just feel like it sounds strange to their body. But as they get older, they become more used to it, and all those things will stop. Please, everything is not antibiotics. We don't just use antibiotics anyhow. It's very dangerous, because you are setting up your baby for what we call antibiotic resistance. And when your baby now need antibiotics, they are not going to work for them because you have misused them. And we don't really have many new antibiotics coming up. So if the common antibiotics don't work for you, it can be a death sentence. So please don't just use antibiotics anyhow. In other countries, you can't buy antibiotics without the doctor's prescription, and nobody cares who you are. You can't buy it. I know it's something that we still need to work on in Nigeria. People just go into the shop and buy antibiotics. I'm challenging the pharmacists to do something about it. It's wrong. So please don't do that. Honorable Babalola, I've answered your question. Just follow my advice. Okay. Okay, Precious, if you check on our group or you have this question on our group, we'll tell you how to assess that. Can I give 6 months baby puree? Puree, what you mean puree? Like food made into puree form, you can. But please, go to our Facebook group, go to our guide section and do the course on complementary feeding so that you will understand how to go about it. It's very important. Okay, Onize is saying, please, ma, I heard it's not good to massage newborn with hot water. What should we do in case a newborn whose head is big or elongated? Just leave the head alone. If your baby, number one, for you to say baby's head is big, let the doctor measure it. That's why we always use a tape to measure the head. And a big head is not even because is we want the shape or anything. It has to do with what is making the head big. Is there too much water in the head, or is there something else in the head going on? So please leave the baby's head alone. You don't need to massage, you don't need to mold or whatever people think they are doing. Just leave it alone. I know what you're talking about, but that's all Yoruba belief system. I'm sure you have people in other countries who don't do all those things, and you don't go see them and think their head looks awkward, like different from your own. Those of you that think you are massaging, you're actually doing nothing. You're just giving the baby unnecessary pressure. And like I said, the baby's head are so fragile, their brains are still developing. You can easily damage uh, things in the brain just with all those unnecessary pressure and massages you're doing. Even just shaking the baby alone can damage blood vessels in the brain, and they can develop brain damage and disability for life. So please, all those of you that will be shaking baby, don't do that. Those of you that will be turning them upside down, they will say they are massaging, turning it up and down. Please, those things should be criminalized. I mean, people should be arrested for doing such things because they are causing a lot of damage. And then these days we have a lot of children having difficulties and we can't explain them. We don't know whether it's from all these unnecessary shaking, massaging, all those things that people do that have caused brain damage. So please don't do it. Just leave it alone. Thank you. All right. Good day. My baby took immunization and had a swollen thigh. What can I apply? Good. That's a very good question. Most babies, after taking the 6 weeks or 10 weeks or 14 weeks immunization, can have bleeding because it's a deep intramuscular injection, so there's a little bit of blood coming out. The same explanation I give you for the when they fall and their heads swell up, just put ice pack on it. That is for to stop bleeding. Anything that is due to bleeding, all you need to do is to put ice pack on it. So that's what you need to do. Please don't massage it with hot water. Please don't put kerosene. Please don't put close up. You always wonder I know all these things because these are things people have done, they've told me they've done, or I've read them, or even some people will come and comment such nonsense on our group. So that's how I know all the things people do. So most time when I tell you what to do, I also tell you what not to do, because some people will say, okay, this is what I say they should do, but another mother who is an experienced mother is going to come and tell them, okay, in fact, don't you put close up, it's going to go in 1 minute. Please don't. And because they don't tell you those children that have the consequences that are bad, we are the one that will have to deal with it as well. And sometimes bad people don't, when people have had through bad experience, they don't like to come and tell you this is my bad experience so that you won't judge them. So you will never see those kind of mothers commenting about it. So please just put ice pack intermittently, like every 20 seconds, every few minutes. Just put it, and that's all. And make sure you are gentle with the legs. Don't just keep carrying the baby leg up and down. It's very painful, and so they're a bit sore. So all you need to just quickly apply ice pack, give the baby paracetamol if they have fever. 2-3 days, everything will go down. But some people would have massaged, some people would have done rubbing, because what you do with that method is that you can introduce germs and bacterial infection into that swelling, into the blood, and then that will now become infected. It become what we call a cellulitis, or you can even turn into an abscess that there's a pus inside. And when that happens, what happened? You will now need to go to the hospital. We will now need to admit your baby. We will now need to give you antibiotics. We will now need to do what we call incision and drainage, opening up the place and bringing out the pus. So it's another long journey for the baby. So which is all preventable if we just are careful, just put ice pack, be gentle around baby, and within 2-3 days, everything will resolve. All right, I hope that's helpful. So thank you so much. I finished all the Facebook questions, so I can quickly go and clear those on Instagram. I know Instagram people, sorry that I left you for so long. But I'll answer your questions. Okay, I think I've answered Naomi's question. Um, Sunny Tiny. Okay, I think I've answered Sunny Tiny's question. What's the maximum quantity? Okay, I've answered the question. Sorry, don't mind me. Okay, look, is your Conde is saying, good evening, doctor. Is there an implication for my baby born in a country where HB first immunization? Is it hepatitis B you're saying? Please avoid abbreviations because your abbreviation can mean different things. HB can mean hemoglobin, can mean different things. So please write in full. I know it's difficult, but please write in full because so that I will know what you are really saying. So what is HB? Are you saying hepatitis B vaccine? The appropriate, if you want to abbreviate hepatitis B vaccine, is HBV. If you don't put it that way, people will not know HB means hepatitis B. So I will not answer your question. Please just let me know which one so I can answer it properly. I don't want to make assumption because I don't really know what is HB. Go Joby say my 2 months was 2.4, about 3.5 now. And you're worried that she's not getting weight. So your baby is 2.4, now 3.5. So your baby has gained 1.1 kilos in 1 month. That's good. So I'm not worried about that. Just keep breastfeeding the baby exclusively and all that. She doesn't cry for hunger here. Why does she have to cry? Just breastfeed the baby. When your baby is crying, it means you have not responded to other cues. You should respond to cues before baby start to cry. Ego Bunny, yes, let him fall so that I will learn. Okay, Ego Bunny is responding to my issue about fall, that let baby fall so that I can learn. Please don't have that. Nobody should be saying baby should fall so that they can learn. You may not like what they are going to learn because you are the one that's going to do all the learning now. Yeah, let's move on. Just be careful with your baby. Hello, doctor. Okay, Angela, thank you for joining. At the sample, I say my baby is 17 months old. He's a boy, but not yet calling mommy or daddy, but he's making sound talk. Okay, but I don't understand. Should I be worried? Yes, your 18 months old should be talking. Your 17 months old rather, sorry, should be talking, should be saying mommy and daddy, should be saying words. So if a 17 months old has no words, I'm worried and I want you to see a speech therapist and get them sorted. Okay, yeah, well, I don't really have so many questions on Instagram though. That's good. So I've answered all of them. I hope that nobody have left their question unanswered. Okay, Geo Joby is putting your question in the box. So your baby was born 2.4 kilo, was at 40 weeks. Your baby was actually small for gestational age. But I think baby is gaining weight gradually. I just curious as to why the baby has the was born 2.4 kilo. Did you have any health issues? You should ask your doctors that question. They'll be able to answer you why that happens. So yeah, I hope I've answered all Instagram people's questions. Let nobody say I omitted the question. I think I have. All right, thank you so much. And I'm running up now. So another Facebook user is saying my baby is 3 months. Your baby didn't cry at birth, but baby is 3 months and it seems to be doing everything well. Should you be worried? No, you shouldn't be worried. Then, but you should still see your pediatrician anyway, because some of the things you say your baby is at 3 months is doing is not true. Your 3 months old baby does not recognize your 3 months old baby does not recognize babies and mommies and daddy's face. Your 3 months old baby can smile at you, yes, but maybe your own understanding of recognition is different from my own understanding. So let's leave that one. It can tongue well. It plays with his leg and hands. The most important question I want to know about your 3 months old is can he carry his neck? Can he carry his neck? That is the most important developmental milestone I want to know in a 3 month old who did not cry at birth. Can that baby carry the neck now? Does he have neck control? If he has neck control, good. Every other thing else is fine. Okay, blessing. Thank you. Thank you so much. Okay, thank you so much, everybody. Oh, I didn't do so bad today. I think I was able to answer all the questions, and I've only done just 90 minutes extra time. So thank you so much for joining me. This program has been brought to you by Atp Pediatricians Foundation. If you still have questions or I didn't answer your question to your satisfaction, feel free to post your question on our Facebook group from Monday to Saturday. Every 24 hours, we're always there. We have 3 Facebook groups. We have Ask the Pediatricians, which is our initial Facebook group, and that's why our name is Ask Pediatrician Foundation. Is for children's health issues only, and children is 0 to 18 years. Anybody above 18 years, you're not a child, so don't ask questions about yourself on the group. But we have the ATP Family Facebook group that is for adults and any adult health issues, pregnancy, all that. Then we have what we call the ATP Still a Mom Facebook group. That is for those who have suffered, those who have experienced pregnancy or child losses and they need support, and we are there to support you. So you can join all our Facebook group. And you can ask your question. Please, when you ask questions on our Facebook group, ask questions in the right group. So don't ask adults ask questions on it's Ask the Pediatrician. Don't ask children health issues on ATP Family, and if you go to ATP Still a Mom, ask questions related to what the group is about. So, and you can ask your questions and we answer them. If you want to consult with any of our professionals, we also have what we call ATP clinics. You can book your consultation. It's usually online. So you can have a chat with a professional. If you want to one-on-one chat with us, you can do that. If you want to book a consultation, if you're in Lagos, we can actually see you face to face. But you have to pay, and then we can arrange the consultation for you. It is not free. And like I said, for the first-time moms, we have a course. What's the name of the course? Okay, I've forgotten now, but it's a first time mom course, so you can also access that as well. But you need to contact me because it's on private for you to get access to the course after payment. So I think that's all the question I have for you. Thank you so much. And if you want to support anything ATP, just ask on our group. We'll give you all our details. We also do community outreaches in different parts of Nigeria and in Ghana as well. So thank you so much. And I will see you all guys next week, God willing. Bye.